Pneumonia and bronchitis are common respiratory illnesses that can significantly impact your health. They affect millions of people worldwide, causing a range of symptoms that can vary in severity. While they share some similarities, they are distinct conditions with different causes and treatments. It's important to understand their differences for proper diagnosis and treatment, as misdiagnosis can lead to ineffective care. Pneumonia is an infection of the lungs that can be caused by bacteria, viruses, or fungi. It inflames the tiny air sacs in your lungs called alveoli, which are crucial for oxygen exchange. These sacs fill with fluid or pus, making breathing difficult and reducing oxygen levels in the blood. Bronchitis, on the other hand, affects the bronchial tubes, which are the airways that carry air to and from your lungs. These tubes become inflamed and swollen, often due to a viral infection or exposure to irritants like smoke. Bronchitis causes these tubes to produce excess mucus, leading to a persistent cough and difficulty breathing. Understanding the differences between these two illnesses is crucial for effective treatment and recovery. It allows for timely medical intervention, prevents complications, and ensures better health outcomes for patients. Both pneumonia and bronchitis can be caused by various factors. However, the most common culprits are viruses and bacteria. Viruses like the flu virus are a leading cause of pneumonia, especially in adults. Bacteria like Streptococcus pneumonia are also common culprits. Bronchitis shares similar culprits. Viruses are the most common cause of acute bronchitis. However, bacterial infections can also lead to this condition. Other irritants like smoke and air pollution can also trigger bronchitis. Identifying the root cause is essential for effective treatment. Your doctor can determine the cause through a physical examination and specific tests. Pneumonia and bronchitis share some common symptoms, making it tricky to distinguish between them. Both conditions can cause a persistent cough, fatigue, and general malaise, which often leads to confusion in diagnosis. However, some key differences exist that can help in identifying the correct condition. Pneumonia often presents with a high fever, chills, and a cough that produces phlegm. This phlegm can sometimes be rust-colored or tinged with blood. Chest pain, especially when breathing deeply, is another telltale sign of pneumonia. This pain can be sharp and worsen with each breath. Shortness of breath, fatigue, and confusion, especially in older adults, are also common symptoms of pneumonia. These symptoms can be severe and require immediate medical attention. Bronchitis, on the other hand, usually presents with a persistent cough that can last for weeks. This cough may produce mucus, which can be clear, white, or yellowish. The presence of mucus is a key indicator of bronchitis. Other symptoms of bronchitis include chest discomfort, wheezing, and shortness of breath. These symptoms can be particularly troublesome at night. While overlapping symptoms can cause confusion, understanding these key differences helps in seeking prompt medical attention. Early diagnosis and treatment are crucial for both conditions to prevent complications. Section 4. Comparing the two illnesses. While pneumonia and bronchitis share some similarities, they differ in terms of severity and potential complications. Pneumonia is generally a more serious illness than bronchitis. It can lead to life-threatening complications, especially in young children, older adults, and those with weakened immune systems. Bronchitis, on the other hand, is usually milder. It often resolves within a week or two. However, chronic bronchitis, a long-term condition, can persist for months or even years. Recognizing these differences is crucial for understanding the potential risks associated with each illness and seeking appropriate medical care. Section 5. Treatment and prevention. Treatment for pneumonia and bronchitis depends on the underlying cause. It's essential to get a proper diagnosis from a healthcare professional to determine the best course of action. Bacterial infections are typically treated with antibiotics. These medications help to eliminate the bacteria causing the infection and should be taken as prescribed. Viral infections, on the other hand, are usually managed with rest, fluids, and over-the-counter medications to relieve symptoms. It's important to stay hydrated and get plenty of rest to support your immune system. Prevention plays a crucial role in avoiding these respiratory illnesses. Simple measures can make a significant difference in reducing your risk. Getting vaccinated against pneumonia and influenza can significantly reduce your risk. Vaccines are a powerful tool in preventing serious complications from these infections. Practicing good hygiene, like frequent hand washing, also helps. Hand hygiene is one of the simplest and most effective ways to prevent the spread of infections. Avoiding smoking and exposure to secondhand smoke is crucial in preventing both conditions. Smoking damages the lungs and weakens the immune system, making you more susceptible to infections. By understanding the causes, symptoms and treatment options for pneumonia and bronchitis, you can take proactive steps to protect yourself and your loved ones from these respiratory illnesses. Staying informed and following medical advice is key to maintaining good respiratory health.